We haven't had a lot of patients with Ibrutinib resistance. Some of the patients who develop Ibrutinib resistance have Richter's transformation as their resistance, the clinical picture for their resistance. And that's probably 30 to 40% of the patients. Some of the patients have just resistant disease without transformation, and then some patients will come off treatment because of tolerability or toxicity or infection. So we worry about the Richter's transformation. In terms of genetic changes or mutations that develop in those patients, it's probably not as significant of an issue in terms of monitoring for mutations, etc. Those patients will need to move on to aggressive treatment for Richter's or clinical trial. In terms of the patients who have progressive disease but not a transformation event, there have been cases described where mutation in Bruton's tyrosine kinase has occurred, or a downstream molecule, PLC2 gamma, which render resistance to the Ibrutinib. I think those are important in terms of clinical research, in terms of collecting data and knowing what the incidence is and whether or not that's the predominant mechanism of action. In terms of the standard clinical use of the drug, I don't think there's really an indication to be monitoring for that mutation or those mutations, or adjusting treatment based on that. There's not quite enough data yet to have an idea about what the clinical utility is for the mutation analysis. But I think it's important for us as academic centers to collect that data and to be monitoring for those mutations. And so we've set up an assay in our clinical lab where we're doing that for research purposes.